We do pediatrics as outpatients instead of hospital. And I think that's very important because in children, it's very unnatural, I feel, to put them in a hospital because they get very frightened. It upsets the whole routine, especially if there are other kids at home. Hi, I'm Dr. Agnes Tay. I'm a paediatrician with IBCA at Parkway MediCentre. Asthma, by definition, is a reversible narrowing of the airway. So when the airway is narrowed, then the child may start off with coughing. The cough gets more and more persistent. Then they may have wheezing, realize that the child is struggling, that the child is breathing faster than usual. The child is drawing in his ribs as he breathes. And then they're using the muscles. You can see that the tensing up. Yeah. Anytime a child is breathless, then they need to see a doctor. There's not a lot that you can do about asthma specifically, but things like smoking, try to make sure no one at home is smoking. If you do have like grandparents who insist on smoking, then try and get them to smoke outside the house, that sort of thing. And then also if it's, sometimes they say, oh, it's not us, but it's the neighborhood, there's a lot of construction going on, then sometimes we're to try and use an air purifier if needed, keep the child away from the very dusty environment. Or they go to cold country, take up winter sports, as always when the cold air can bring it on. Because I've been to very cold countries where suddenly I start coughing. So I didn't have a full-blown attack, but I knew the cold air was very cold, it was doing something to me. So I have my inhaler with me as a safety. Some people do, some children do, some don't. Yeah. So unfortunately, it's not very easy to predict who will or will not outgrow. But I usually tell the parents that we work on controlling it. So we control it and then as they get better. Because the danger with saying that they have outgrown is that I have seen children who do very well and then they're off the inhalers for many years. But then one day when they get when they're much older and they go to NS, and then whether it's stress, psychological stress or bad virus, then they start to wheeze. So I have to tell them it's good if you're able to outgrow it, but even when your symptoms are under control, then you still have to be mindful that this can happen. Well, I tell them that they need to get to know the child and to know themselves and to know when they need to get help.